Dr. Rosenberg, big news just in the last couple of days. The governors of New York, New Jersey, and Connecticut have implemented a 14-day quarantine for visitors from out of state, and specifically states that are currently surging in COVID cases, Texas, Florida, and others. Is it your opinion that those states reopen too soon? And how else can we explain these rising case numbers?
Great question. So I'll start just by saying that it's really hard to make a blanket statement. Like, the truth is, our national epidemic is really a collection of many epidemics at the state level or smaller. So it's really hard to make a single statement that applies to, say, all states that aggressively reopened did so too quickly. That being said, at the same time, at the time that many of the states that are currently surging had reopened, and sort of many of which were in the lead up to Memorial Day, the epidemiologic data were not in favor of them reopening to such a liberal and broad degree. Reopening seemed to be more driven by political, economic, and public pressures, and frankly, fatigue. I think part of that is, maybe in the way that we shut down, which is that many states shut down sort of around the same time, a very short time frame, even though the epidemic was not surging in all of those places. So that increases the amount of fatigue that everyone has. I will say, though, at the time, many epidemiologists, myself included, thought that we would see a resurgence after such drastic reopenings about a month later, and here it is. So I think, yeah, it speaks for itself.